Hello, my name is Jeremie Wharton, and I am the Assistant Director to Intensive Outpatient Services at Southland Mental Health. Southland Mental Health does in fact have a couple of programs that are intensive treatment team programs, and one of those programs is the ACT team. It's the Assertive Community Treatment Team. This is a program that serves adults with severe and persistent mental illness in the community. And this is a team that has been around for Southland Mental Health since 2010. This team is made up of about 10 people with varying specialties, and we serve about 50 people in the community. This team has a psychiatric nurse practitioner, we have a nurse, certified nurse's assistant on the team, we have occupational therapist, clinical social worker, we have therapists pursuing their licensure, we have a peer support specialist, alcohol and drug counselor, and skills trainers and more. So I am looking forward to introducing you to a few of them, and you can hear a little bit more about this team approach from them.
Hi, I'm Dr. Tafoya, and I am the supervisor of the ACT team. We go out in the community as team members and service clients within the community. These clients have a very hard time navigating the system, navigating the community. So basically we help them and support them and kind of wrap around them so they're able to stay in the community and not end up in hospitals or in police custody, or in, have kind of relieves a little bit of the pressure off the residential treatment facilities and other facilities. When you have all these multidisciplinary people all in one place, they can all work together very tightly and communicate. We have meetings every day to kind of case manage the clients on a daily basis. So that helps the clients get the needs met the fastest, and also in a coordinated effort. We work really well with the Cottage Grove Police. We have an ED, Southland Mental Health has an ED team. If somebody ends up in the hospital, we get contacted right away. We're able to send somebody down there and communicate for the client and with the client, because the client, a lot of times they have a lot of anxiety and a lot of fear. So they know us. We're really well acquainted with the clients. They're acquainted with us, so it helps everything go smoothly through the hospitals. We're able to disseminate information so the hospital knows what's going on with the client in a very expedient manner, which gets the client services faster and appropriate services. A lot of times, clients end up in the hospital. Doctors there don't actually or necessarily know what's currently going on with the client, so that kind of slows the process down, and with us there, we're able to coordinate to the point where everybody's on the same page for the client, and it helps the client tremendously.
Sam, it sounds like this team does a lot of good work for this community. Southland Mental Health is very proud of its ACT team services.
Well, thank you. I really like helping the people out here. I really like the community, and I think it's better for all.
My name is Amy Mangum. I'm an occupational therapist and a qualified mental health professional on the ACT team, and I work with clients to achieve their highest level of independence and self-sufficiency in their natural environment. And this here is Ami. She is our therapy dog, and she is trained in sniffing out panic attacks and is actually able to intervene before they go into a full-blown panic attack. And she is also trained in sniffing out self-harm, so she can notify therapist if a client has had a recent act of self-harm.
Would you be able to, kind of give me some insight onto what is the benefit of having this type of a team approach and what it's like working on such a team?
Absolutely. So it's an honor to work on this team, and I would say one of the main benefits is we are able to meet a diverse level of needs from our clients. So all of our clients have different types of needs, different level of need, and because our team is so diverse in their background of profession and life experience, we're able to kind of use one brain to kind of have like a team think and come up with creative ways to meet people's needs in the moment. As COVID has become an everyday part of our life, we have seen how it's affected a lot of our clients, and also honestly our staff in general, and we have been able to come together to work with people in these moments to achieve kind of greatness. And so, for example, we have a client that has a hard time maintaining her home and her own personal hygiene. However, both of those things are really important to her. And when COVID first started, her housekeeper that was coming weekly no longer felt comfortable coming into her home. And so we were behind her in supporting that decision of safety, but we did recognize that it kind of put our client in a really difficult situation because she does care so much about her health and hygiene, but was not able to maintain that. And so her house kind of over the past couple months has moved to a relatively inhabitable environment, but as a team we were able to get suited up in some boots and some coveralls and masks and 2 pairs of gloves, and get in there and do a big muck out with our client and her partner, that then kind of got her home back into a more manageable state. And so we were able to also have some wraparound services of finding housekeepers that felt comfortable coming inside and wearing masks and meeting with her weekly to continue to kind of maintain this clean and healthy home.
That's excellent. Sounds like a real testament to the lengths that the ACT team is willing to go to take care of the community members that we serve, and some of the real challenges that some of our population are experiencing right now.
Yeah, absolutely.
Can you tell me, like, what's your motivation? Why do you do this work?
I do this work because I wholeheartedly believe in this work. I recognize and understand that the importance of being able to provide services in someone's natural environment allows for the largest transference of skills and for the biggest amount of success, because you could go into a hospital and learn wonderful coping skills, but when you get home those don't necessarily translate when your environment is completely different than the artificial environment that's created in a hospital. So by doing this work, I feel as though I'm doing something that I believe in and that I care a lot about and that I see success in nearly every day.
So Amy, thank you very much. Omi as well. Thank you both for the interview, and once again, we're very grateful.
Thank you. I am honored to be able to be a part of this team and to serve Cottage Grove.